So yeah, I'm the founder of a company. We make software for gyms and trainers. Our bigger vision is how we are bridging the gap between fitness and healthcare, how we're trying to make fitness an extension of healthcare. We all know fitness is the #1 form of preventative healthcare, and money spent on prevention is usually money saved on treatment in the future, but there's still that disconnect between the two. The last time I was here, I spoke about this. Spoke about this a little bit a couple years ago. Thought this is pretty easy. There's a gap between these two. Fitness is unregulated and profit-driven. Healthcare is evidence-based. So the solution lies in bringing some tech, which can help engage more people on the fitness side, capture the data that is needed, and enforce an evidence-based approach. So I thought this was pretty easy. Step one, healthcare with fitness. Put some technology in between to bridge it, and then we can get them together. The reality of it, when we got out into it, is that it's totally fragmented still anyways. There's not any uniformity on the healthcare side. There's not much uniformity on the fitness side. There's a lot more steps to it than just sort of add tech and scale. So about a year and a half ago, I got involved with a program called Prescription to Get Active. So this was a not-for-profit that was operating, that was bringing many of these stakeholders together. At least with Prescription to Get Active, what they were doing is they were bringing doctors and family health teams together with rec facilities and fitness facilities. So the idea behind the program is doctors can write prescriptions for fitness to treat any condition. That prescription gets taken to a fitness facility for like a free 30-day membership or a free trial to help them get started and get going. So that program was launched in Alberta in 2011 and has got not-for-profit 2 years ago. So these are the stats for 2017. 13,278 prescriptions were written in Alberta in 2017. Redeemed at 3,457 were redeemed at facilities and through the website. 43% of those people bought further passes in the website as it was. We kind of rushed the slide deck here, so it shouldn't just be number signs. It's the number of doctors. There's 92% of doctors in Alberta are prescribing fitness right now. So they've had a huge reach, a really good success to this program. 27 communities are throughout the province are prescribing it. And then there's 170 different fitness facilities and rec facilities in the province also being providers on it. So lots of success in Alberta. And now we've tried to bring the program to Ontario. So I got involved about a year and a half ago. Of course, being the tech entrepreneur in the table, the only one sitting around the table with healthcare and fitness and other people in that sector, in the wellness sector and in the not-for-profit sector. I came in super overzealous, came in guns blazing, ready to do everything. We needed mobile apps, we needed better user engagement, more online training options, connecting all the pieces here. Is all this vision for fitness that I had that should be in 5 or 10 years, and that's what I was trying to sort of make right up from the start. It was interesting to sort of come in and see, because I came in, proposed all this stuff, was the tech guy, all that stuff, and of course it was completely overwhelming to the national body, to the group in Ontario, completely ineffective at moving anything forward. They all said, yes, this sounds great that we'll have mobile apps, this sounds great, this is everything, but we just need people to fill out the paperwork first to get signed up on the website. So it was way, way, way further. I was at step like 8, and these guys, we weren't even close yet. So bringing it back to getting it going in Ontario, it was interesting because obviously Ontario is bigger. The program here had a lot of advantages to it. You had a lot of the right stakeholders right from the start. You had a lot of good people in healthcare. You had the VP of fitness from Good Life, for example, Mo Hagan, on the board. So some really good, interesting people that were right there at the table. The city of Markham has been super involved. And we had a blueprint of success from Alberta. We'd seen what had worked, what kind of hadn't worked, what needed to be corrected. And there was also tons of interest. Lots of communities wanted to get going. In fact, we had to be selective at which communities we wanted to get started with because there was so many that wanted to get going at the start. But of course, there was a lot of challenges. It was a year and a half ago that I got involved that we thought we'd be launching at least a year ago in this program. Some of those challenges were what you'd expect from having this many stakeholders, the regular bureaucratic delays. Some of them were legal delays, again, being on the not-for-profit side, and now you're also dealing with healthcare. So now there's issues around, how does any sponsorship money go? How do things work? That causes delays in everything. Anytime there was an issue with an agreement or a contract, it would have to go to a national board and then get kicked back and go to lawyers. So you would set delays that would take months at a time. Just the realities of dealing with this stuff. And then, of course, there was also technical delays. The biggest delay of getting Ontario launched was just getting the website going. And it wasn't that the website couldn't accommodate for Ontario that was already in Alberta. It was that no one was really sure how to enter things properly and get new people onboarded because the administrator had left the national board in Alberta. So where I thought we were going to have to rebuild a whole website and redo the whole experience and everything, all it really needed was a little bit of data entry. But again, some little things that took weeks and eventually months to get the program launched. And again, now the program has been launched, sort of soft launched in Ontario just over the last month or so. We're up in 3 communities, Markham, Forest Hill, and London. So if you look at the map here, these are fitness locations, rec locations available in Markham, for example, if you go on the website and get it going. So it has kind of been launched, not fully in all the communities. There's still some delays. You have Good Lives in some communities, but not in others. You've got rec facilities in some, but not in others. So there's still some challenges to getting the whole system implemented as it was. And next steps. So next steps is all about adding more fitness facilities within the communities that have already started to launch, and then adding more communities with adding, or the clinics and other family health teams coming on board to be able to prescribe. Putting in a full-time project manager who can manage all of this stuff, contacting people in the communities that are there, onboarding them, doing the training, all the just operation stuff that needed to get stuff going. Right now it's been completely volunteer. Everybody that works on the board in Ontario, it's on the side of their desk from their regular healthcare job, their fitness job, whatever it is. So having somebody who can push it forward and operate it is really important. We're looking at obviously raising a little bit of funds to be able to cover that project manager, the operation costs, things like printing prescription pads, little things just to get it going. Really important about tracking outcomes. Again, we'll touch on that in a minute, but one of the biggest challenges of expanding the program and success to the program has been tracking outcomes in this. You saw some of the numbers that are there. You have the number of prescriptions that are written. For the most part, that's counted by how many prescription pads are sent to the family health teams as opposed to actually getting it in the EMR systems, because of course that's a friction point. Having a doctor, having a clinic put that in as a friction point to track it. Now get to the gym side of things. Someone walks in with a prescription to a gym, having everyone at that gym trained on how to handle that prescription, how to put that person in a system, how to onboard that patient who's not supposed to be sold anything. They're supposed to be treated as a newcomer to that. So some challenges in tracking the outcomes, which is what the key is to really scaling a program like this, to get it to sort of the vision that we see for this. And part of that is, I mentioned someone here from UHN, also working with people like UHN to start backing up some of the research, getting some of that involved in it, and looking at how a program like this does scale. And again, it comes with funding to be able to scale something like this, but funding requires the tracking of outcomes, which requires the people to be trained on doing it, which requires the operation in the system first. So the vision, the bigger vision that we've sort of talked about, or that I've kind of articulated in the Canadian healthcare system, is how from a prescription from healthcare can come into Prescription Get Active as the sort of online resource, and people can go into more self-directed resources or into online resources or to facilities. So Trainer Plus, our platform, is what provides a lot of the online, but this is a way, if you look at some of the names here, getting different stakeholders involved, having the facilities like the YMCAs and the Good Lives, having somebody like Exercises Medicine Canada or a certifying body that has more certified, qualified fitness professionals that are trusted more by the healthcare space. The orange is for our friends at Carrot, who can help motivate people with rewards to get them moving up. So really, really quick, we learned a lot of things about how to make the program more successful, but my big takeaways from it as the tech entrepreneur at the table, as the person who what my role is in the table, other than just answering basic questions about how to set websites up. One is being able to get people to take that lean approach to things, get things going, and move it, be the one that's always pushing to be that catalyst. My experience from learning how to leverage funding, everyone thinks about it in this healthcare sense, but when you think about it as an entrepreneur, you think about hiring funding and technical funding and all the different ways of leveraging the funding that's out there that's not just for healthcare research. Thinking of the user experience or the patient experience in this point, very little thought has been given to that, but the whole success of the program goes to that experience. And lastly, just finding ways to add value to all the stakeholders in the room and not just thinking about our own silos. This is sort of key to that, the key to this program growing. So thanks, I think that's it. I got one more slide that just has my websites on it. There you go.
Perfect. Thank you, Nick. One question Hey Nick, very interesting product. I was curious because it's interesting to get actually fitness as a prescription. Is this something that like insurance companies are going to subsidize, or have you kind of been talking with insurance companies that, you know, if you get drugs for whatever reason, they subsidize? Is this something that I guess you guys are looking to do?
Yeah, absolutely. I mean, when I look at this problem, I look at it through the spectrum of like what I call, you know, kind of extended healthcare and insurance, especially because the U.S. is our bigger market for us as a company. So we look at healthcare as an extension of insurance up there. Here it's a little bit different. There's things that we're doing, like we have a service on the side that uses our software called fitnessplans.ca. We provide that service as online training on League, for example, on the League marketplace. So there's definitely some of the more progressive companies. Sun Life probably needs to talk to us at some point in time too. Some of the more progressive companies, some of the online services. So what we're learning from our tech is it fits differently in corporate wellness. It's more about, okay, how can they leverage it as online fitness wellness options here in Canada? Obviously in the States it's different. This is the extension of healthcare and their health insurance. Yeah.
Thanks, Nick.
Thank you.